A woman in Texas went to the emergency room with a sprained ankle. Ice pack. X-ray. Wrap it up. She was there for 47 minutes. Her bill? $11,372. The hospital charged her for a level 5 trauma assessment usually reserved for gunshot wounds and heart attacks. They billed for medical supplies she never received. They charged for a doctor consultation that never happened. She fought it for 18 months. The hospital admitted to billing errors but never faced consequences. This isn't a mistake. It's a system. And it's costing Americans over $68 billion every single year. Imagine getting charged for a Ferrari when you rented a Honda. Imagine being billed for a 5-course meal when you ordered a sandwich. Imagine paying for 15 items at the grocery store when you only bought 3. You'd be outraged, you'd demand a refund, you'd report them to authorities. Now imagine that's happening in healthcare, where you're unconscious, in pain, or terrified for your life, where you can't comparison shop, where you don't understand the billing codes, where the bill arrives months later, too complex to decipher. That's medical upcoding and phantom billing. And it's not rare, it's systematic. Upcoding is when healthcare providers bill for more expensive services than what was actually provided. You got a basic checkup, they bill for a comprehensive examination. You had a simple consultation, they code it as a complex diagnostic assessment. Phantom billing is even simpler, charging for services, tests, or supplies that were never provided at all. Ghost procedures, imaginary medications, fictional equipment. Hospitals do it. Doctors do it. Medical equipment suppliers do it. Pharmaceutical companies enable it. Insurance companies sometimes ignore it because fighting every fraudulent claim costs more than just paying them. And patients? We pay the price. In higher insurance premiums, in surprise medical bills that bankrupt families, in a healthcare system where the cost bears no relationship to the actual care provided. Between 2010 and 2020, the federal government recovered over $3 billion from healthcare fraud cases. That's just what was caught and prosecuted. The FBI estimates that healthcare fraud costs Americans between $60 and $90 billion annually. Today, we're exposing how a system designed to heal has been weaponized to steal. Let me explain how medical billing actually works, because understanding this is crucial to understanding the fraud. When you receive medical care, everything gets translated into codes. These codes are part of a system called CPT, Current Procedural Terminology. There are thousands of these codes, each representing a specific service, procedure, test, or diagnosis. A basic office visit for a new patient might be code 99202. A more complex visit is 99205. The difference? About $200. Same amount of time, same doctor, but the complexity of the visit determines the code, and the code determines the payment. Here's where it gets interesting. Who decides how complex the visit was? The doctor. There are guidelines, sure, but there's massive grey area. Was it really a level 4 visit or just a level 3? Did the examination truly involve reviewing multiple systems, or was it focused on one complaint? That discretion creates opportunity. Now add this. Doctors and hospitals are often paid based on what they code, not what they actually do. The more complex the code, the higher the reimbursement. Insurance companies and Medicare pay, according to the code submitted, usually with minimal verification. So we've created a system where providers select their own codes, are paid more for higher codes. Face minimal verification. Know that patients rarely understand the codes well enough to challenge them. It's like letting students grade their own exams and trusting. They'll be honest. Here's a real example from a case that was prosecuted. A cardiology practice in Florida routinely performed basic EKGs, electrocardiograms, simple heart rhythm tests. These should have been coded as $93,000, which pays about $17. Instead, they coded them as $93,015. Cardiovascular stress tests, which pay about $200. Same machine. same procedure, same 5-minute test, but they called it something else on the billing form. They did this thousands of times over 3 years. Medicare paid them without question. The fraud was only discovered when a whistleblower, a nurse who worked there, reported it. The practice made over $4 million from this single coding scheme. Or consider this. Hospitals have different levels of emergency room visits. Level 1 is minor, splinters, small cuts, basic issues. Level 5 is major trauma, heart attacks, severe injuries, life-threatening emergencies. A study published in 2019 analysed millions of emergency room visits. They found that from 2006 to 2015, the percentage of visits coded as high level increased by over 40%. Did emergencies suddenly get more severe? No. Hospitals just started coding them as more severe, because a level 5 ER visit can be billed at 5 to 10 times the rate of a level 2 visit. Upcoding is subtle. Phantom billing is brazen. Let me tell you about a case from Michigan. A home healthcare company was billing Medicare for nursing visits to patients. Routine stuff: checking vitals, administering medication, monitoring recovery. Except many of these visits never happened. The nurses would mark down in their records that they visited Mrs. Johnson for 45 minutes. They'd document her blood pressure, her medications, her condition. They'd submit the paperwork. The company would bill Medicare. But Mrs. Johnson would later testify she hadn't seen a nurse in weeks. How did they get away with it? The patients were elderly, often with memory issues. Many were isolated, living alone. Some had cognitive decline. They weren't going to challenge the bills or even know they were being billed. The company made over $12 million billing for phantom visits before a family member of one patient noticed the pattern and reported it. Here's another common scheme: unbundling. In medicine, many procedures are done together as a package. For instance, during surgery, anesthesia, monitoring, and recovery are often billed as one bundled service. The insurance company pays one rate for the complete package, but some providers unbundle these services. They bill for each component separately. Anesthesia, separate charge. Heart rate monitoring, separate charge. Oxygen administration, separate charge. Post-op recovery room, separate charge. Each individual charge might be legitimate, but billing them separately instead of as a bundle can double or triple the total cost. And it's often technically fraudulent because the billing codes specifically indicate whether a service should be bundled or billed separately. A surgery that should cost $15,000 gets billed as $45,000. Insurance companies sometimes catch this, sometimes don't. When they do catch it, they just deny payment. Nobody gets prosecuted. Then there's the medical supply scam. Hospitals charge for every supply used during your care: bandages, syringes, gloves, gauze, saline solution. These costs are passed directly to patients or insurance companies. Except audits have repeatedly found that hospitals charge for supplies that were never used. Operating rooms have standard setups, and hospitals often bill for every item in that setup whether it was used or not. One investigation found that patients were being charged for surgical kits that included instruments the surgeon never opened. But the kit was in the room, so the patient got billed for it. Even more egregious, billing for brand name medications when generic ones were actually used. The difference can be hundreds of dollars per dose. The patient receives the generic, the hospital bills for the brand name, and nobody knows the difference because the bill just says medication administered without specifics. A lawsuit in New York revealed that a hospital network had been charging patients for brand name cancer drugs while administering generics. The cost difference? Over $30 million over 5 years. Now let's talk about who this actually hurts, because the answer might surprise you. Start with the obvious. People without insurance or with high deductible plans. They pay out of pocket. When a hospital upcodes a procedure or bills for phantom services, that cost comes directly from the patient. Sarah Chen was 28 years old when she had an appendectomy. Emergency surgery, nothing unusual. She had insurance through her employer, but with a $6,000 deductible. Her bill came to $47,000. After insurance, she owed $6,000. She paid it because she had to, depleting her savings. A year later, she happened to request an itemized bill for tax purposes. That's when she noticed charges for things she never received. A respiratory therapist consultation. Never happened. Advanced imaging studies. She only had one basic CT scan, but was billed for 3 different scans. Medications she was allergic to and couldn't have received. She filed a dispute. The hospital corrected the bill. Her portion dropped to $3,800. They'd overbilled her by $2,200 and only admitted it when she challenged them with specific evidence. She got a partial refund. But how many patients never request itemized bills? How many just pay what they're told to pay? Now consider people on Medicare. The government pays the bills, so it's not really a victim, right? Wrong. Medicare is funded by taxpayers. When providers defraud Medicare, they're stealing from all of us. That's $68 billion in annual healthcare fraud. A huge chunk comes from Medicare fraud. And here's the insidious part. Medicare fraud drives up costs for everyone. When Medicare spending increases, they adjust reimbursement rates, which forces private insurance to pay more, which increases premiums for everyone. A doctor in California was billing Medicare for high-level office visits that supposedly lasted 90 minutes each. Detailed examinations, comprehensive reviews, extensive consultations. Investigators tracked his schedule. He was seeing 40 to 50 patients per day. The math didn't work. There aren't enough hours in a day to spend 90 minutes with 50 patients. He was coding every visit as $99,205, the highest level, billing Medicare about $350 per visit. These were actually 15-minute routine checkups that should have been billed at $110. Over 4 years, he fraudulently collected over $8 million. But the damage went beyond that. His overbilling contributed to Medicare's cost calculations for his region, affecting reimbursement rates for honest providers. Other doctors in the area saw their reimbursement rates cut because Medicare thought that region was overutilizing high-level visits. Honest doctors got paid less because a fraudster was gaming the system. Then there are the medical bankruptcies. Over 60% of personal bankruptcies in America involve medical debt as a major factor. Not all of that debt is fraudulent, obviously, but studies suggest that up to 15% of medical bills contain errors, upcoding, or phantom charges. That means thousands of families are filing bankruptcy, partly because they were fraudulently billed for services they never received or procedures that were coded incorrectly. Lives destroyed, credit ruined, futures derailed. Because a hospital billing department decided to code a level 3 visit as a level 5. You're probably wondering, how does this keep happening? Why aren't these providers prosecuted? The answer reveals everything wrong with healthcare oversight. First, the system is incredibly complex. There are over 10,000 CPT codes. The rules for what can be billed together, what requires separate coding, what documentation is needed for each code, it's a labyrinth. This complexity creates plausible deniability. A provider caught up coding can claim it was an honest mistake, a misunderstanding of the guidelines, an error by billing staff. And proving intentional fraud versus incompetent coding is legally difficult. Second, enforcement is woefully understaffed. The Department of Health and Human Services Office of Inspector General is responsible for investigating healthcare fraud. They have about 600 investigators to oversee a $4 trillion healthcare system. That's like asking 6 people to audit the entire economy of Japan. They focus on the biggest cases, the most egregious fraud, small-scale upcoding, phantom billing of a few $1,000s here and there. It flies under the radar because there's no capacity to investigate it. Third, insurance companies often don't fight back aggressively. Why? Because the cost of investigating and disputing claims can exceed the value of the fraudulent charges. If a hospital bills for an extra $500 worth of supplies that weren't used, it costs the insurance company more than $500 in staff time to investigate, dispute, and litigate. So they pay it and pass the cost to policyholders through higher premiums. Insurance companies have sophisticated algorithms to detect patterns of fraud, but individual instances often slip through. Fourth, there's a perverse incentive structure. Hospitals and medical practices are businesses. They need revenue to stay open. Medicare and insurance reimbursement rates are often below the actual cost of providing care. So providers feel justified in optimizing their coding. They'll code at the highest defensible level because they're not getting fairly reimbursed for other services. In their minds, it's not fraud, it's financial survival. This doesn't make it legal, but it makes it widespread. And fifth, patients rarely challenge their bills. Medical bills are confusing. They arrive months after treatment. They're filled with codes and terminology most people don't understand. And patients are often dealing with illness, recovery, or grief. They don't have the energy to fight. Even when patients do challenge bills, hospitals have armies of billing specialists and lawyers. The average person gives up. A study found that fewer than 5% of patients request itemized bills. And of those who do, fewer than half actually dispute charges even when errors are obvious. Hospitals know this. They count on it. Here's where it gets really frustrating. Much of what we're talking about exists in a legal grey area. Is it fraud to code a 30-minute visit as a 45-minute visit when the appointment ran a bit long, but you were also distracted by phone calls? Is it fraud to bill for a comprehensive metabolic panel when you only specifically needed 3 of the 14 tests, but the lab ran the full panel anyway? The guidelines say providers should code for the service actually provided, but there's interpretation involved. A hospital in Texas was sued for upcoding. Their defense? Our doctors believed in good faith that the level of service they provided justified the codes they selected. Clinical judgment varies among providers. They settled the lawsuit for millions but admitted no wrongdoing. And they continued the same billing practices afterward because nothing in the settlement prohibited it. Here's a real example of the grey zone. Emergency rooms are required by law to stabilize any patient who comes in, regardless of ability to pay. This is expensive, so hospitals have started coding more ER visits as trauma activations. A trauma activation is when the hospital mobilizes a full trauma team, surgeons, specialists, operating room on standby. These are coded at the highest level and billed accordingly. Hospitals argue that any patient who might need the trauma team justifies a trauma activation code. But investigations have found trauma teams being activated for minor injuries that clearly didn't require that level of response. A teenager came in with a broken finger from a basketball game. The ER doctor looked at it, ordered an X-ray, splintered it, sent him home. Total time, 35 minutes. The bill included a trauma activation charge, $8,000. The hospital's defense? The mechanism of injury could have indicated more serious trauma, so we activated the team as a precaution. The trauma team never actually saw the patient, but because they were on standby, the hospital billed for their services. Is that fraud? The hospital says no, they followed protocols. The patient's family says yes, you charged for services not rendered. Insurance paid the bill because fighting it would cost more than the charge itself. Then there's the issue of medical necessity. Insurance only pays for medically necessary procedures. But who determines necessity? The doctor. If a doctor orders 10 different blood tests when 2 would have sufficed, is that fraud or aggressive diagnostic practice? If they perform a procedure that has a 5% chance of finding a problem, is that medically necessary or revenue generation? The doctor can always argue they were being thorough, erring on the side of caution, following best practices. Proving that they ordered unnecessary tests purely for billing purposes requires evidence of intent, which is nearly impossible to obtain. This grey zone allows massive amounts of overbilling to occur legally, or at least without clear legal violation. The system is designed to give providers the benefit of the doubt. And that benefit of the doubt is worth tens of billions of dollars a year. Individual doctors and hospitals are bad enough, but the really massive fraud comes from corporate healthcare operations. Let me tell you about Health South, one of the largest healthcare fraud cases in history. Health South was a chain of rehabilitation hospitals. In the 1990s and early 2000s, they engaged in systematic upcoding and phantom billing on an industrial scale. They had a corporate policy of optimizing billing codes. Every patient encounter was coded at the highest possible level. Therapists were pressured to document their sessions in ways that justified high-level billing codes, whether accurate or not. Employees who pushed back were fired. Whistleblowers were threatened with lawsuits. Health South billed Medicare for therapy sessions that never happened. They claimed patients received hours of intensive rehabilitation when records showed they were asleep or had been discharged. They fabricated documentation to support fraudulent claims. When the fraud was finally exposed, the scope was staggering. Over a 15-year period, Health South defrauded Medicare of an estimated $3 billion. The CEO went to prison. The company paid enormous fines. But here's the thing, Health South still exists. It rebranded, paid its penalties, and continues operating hospitals today under a different name. Or consider the diabetic testing supply scam. This one's still happening right now. Medicare covers diabetic testing supplies, glucose monitors, test strips, lancets, legitimate medical need for diabetics. But companies discovered they could make massive profits by convincing people to accept these supplies even if they didn't need them. They run TV commercials. If you have diabetes and Medicare, you may qualify for a free glucose monitor. They make it sound like you're missing out on a benefit you're entitled to. People call in. The company gets their Medicare information. Then they start shipping supplies every month, whether the patient needs them or not, and they bill Medicare for each shipment. Medicare pays because the patient has diabetes and is technically eligible. The patient doesn't pay anything out of pocket, so they don't complain. The company makes money on every shipment. Investigators have found diabetics with garages full of testing supplies they'll never use. But Medicare keeps getting billed. This scheme costs Medicare an estimated $1 billion annually. Then there's the pharmacy angle. Specialty pharmacies work with doctors to prescribe expensive medications, then bill insurance astronomical amounts. A cream for pain relief costs $50 to produce. The pharmacy charges insurance $3,000 for it. They give kickbacks to doctors who prescribe it. The doctor gets paid, the pharmacy makes huge profits, insurance companies raise premiums, and patients who actually need the medication face higher copays. One specialty pharmacy in Florida was billing $500,000 for a single month's worth of prescription creams and pain medications for one patient. The actual cost to produce those medications? About $12,000. They were caught only because the patient's insurance company noticed the patient was supposedly using more medication per month than was physically possible to consume. These aren't isolated incidents. They're business models. So what can you actually do? You can't opt out of healthcare. But you're not helpless. First, always, always, always request an itemized bill. Not the summary, the detailed line-by-line bill showing every code, every service, every supply. Hospitals often resist providing this, insist. You have a legal right to see exactly what you're being charged for. Second, review that itemized bill carefully. Look for services you don't remember receiving, duplicate charges for the same service medications you're allergic to or didn't receive supplies that seem excessive. Did you really use 47 bandages? Time discrepancies. You were there for 2 hours, but billed for 6. If you find errors, dispute them immediately in writing. Send the dispute to both the provider and your insurance company. Third, ask for the CPT codes and research them. Google the codes. Medical coding resources are available online. Make sure the code matches the service you actually received. A Level 5 office visit should involve extensive examination of multiple body systems, detailed medical history review, and high-complexity decision-making. If your doctor spent 15 minutes asking about your sore throat and prescribed antibiotics, that's not a Level 5. Fourth, never pay a bill immediately. Wait for your insurance explanation of benefits. Compare it to the bill. Make sure the charges match. Fifth, if you're having a planned procedure, ask for a cost estimate in advance. Get it in writing. Specify exactly what's included. Then compare the actual bill to the estimate. Hospitals are now required by law to provide cost estimates for planned procedures. Use that leverage. Sixth, if you spot fraud, report it. The Department of Health and Human Services has a fraud hotline, 1-800-HHS-TIPS. Many states have their own reporting systems. Whistleblowers in healthcare fraud cases can receive a percentage of recovered funds under the False Claims Act. Seventh, consider hiring a medical billing advocate. These are professionals who review medical bills, identify errors and fraud, and negotiate on your behalf. They typically charge a percentage of what they save you, so there's no upfront cost. For a $50,000 hospital bill, paying an advocate 25% of their savings might mean you pay them $2,500, but save $10,000. Worth it. And finally, vote and advocate for systemic reform. Support price transparency laws. Back legislation that increases penalties for healthcare fraud. Demand that your representatives actually address this issue. This won't stop until the penalties outweigh the profits. A sprained ankle. 47 minutes in the emergency room. $11,000. The hospital called it a billing error when caught. But it wasn't an error, it was a test. They were testing whether the patient would notice, would care, would fight back. Most don't, and that's what they count on. Medical upcoding and phantom billing aren't aberrations in the healthcare system. They're features of it. The system is designed to be so complex, so opaque, so overwhelming that patients simply pay whatever they're told to pay. $68 billion a year. That's the conservative estimate of what healthcare fraud costs America. That's more than the entire GDP of some countries. That's $200 for every man, woman, and child in America, every single year. And almost nobody goes to prison. Hospitals pay fines that are a fraction of what they stole. Doctors get slaps on the wrist. Corporate executives blame billing departments and move on. The system protects the fraudsters because the people running the system benefit from the fraud. Your insurance premiums keep rising. Not just because healthcare is expensive, but because you're subsidizing fraud. Your deductibles keep increasing. Your coverage keeps shrinking. And hospitals keep billing for services you never received. This isn't about a few bad apples. This is about an orchard that's designed to produce rotten fruit. You went to the emergency room with a sprained ankle, and they charged you for trauma surgery. You had a 15-minute checkup, and they billed it as a comprehensive examination. You got generic medication, and they charged you for brand name. And when you question it, they call it a billing error, adjust it, and do the exact same thing to the next patient. Because the risk is low, the profit is high, and the patients don't know enough to fight back. Until now. Now you know. Now you understand how it works. Now you can protect yourself, challenge fraudulent charges, and demand accountability. The next time you get a medical bill, don't just pay it. Read it. Question it. Fight it if necessary. Because that $11,000 sprained ankle? It should have cost $300. The difference is fraud. And it's time we stopped accepting it as normal. Thanks for watching. If this video opened your eyes to medical billing fraud, share it with someone who's dealing with medical bills right now. Knowledge is the only weapon patients have in this fight. Drop a comment below if you've ever successfully disputed a medical bill or if you've been hit with obvious phantom charges. Your stories help other viewers understand they're not alone in this. Hit that subscribe button for more investigations into systems that are designed to take your money while you're too sick, too scared, or too confused to fight back. Next week, we're exposing the pharmaceutical patent evergreening scheme that keeps life-saving drugs expensive for decades. Stay vigilant and always request that itemised bill.